Can eating too much sugar cause diabetes? Here's what experts say. Does too much sugar cause diabetes? Eating a lot of sugar alone won't cause diabetes. For example, type 2 diabetes, which is 90% to 95% of all cases, comes from genes and lifestyle. The American Diabetes Association says sugary drinks are linked to type 2 diabetes, but a link is not the same as a cause. Other things matter too. Your environment, genes, health history, age, race, activity, and stress. Many people wonder if eating too much sugar directly causes diabetes. While it's a common concern, the reality is far more complex than just one factor. Diabetes is a multifaceted condition that arises from a combination of elements. For instance, type 2 diabetes, which accounts for a staggering 90% to 95% of all diagnosed cases, develops due to an intricate interplay of both genetic predispositions and lifestyle choices. While sugary drinks are linked to an increased risk, it's crucial to understand that a link isn't the same as a cause. Factors like your environment, family history, age, race, physical activity levels, and even stress all play significant roles. Ready to truly own your health every day of the year? Start your journey with Diabetic 365 now and gain the control you deserve. At its core, diabetes means your blood sugar levels are too high because your body either doesn't make enough insulin or doesn't use it effectively. Insulin is the vital hormone that helps usher sugar from your bloodstream into your cells for energy. When this system falters, sugar builds up, leading to high blood sugar. It's not a single disease, but rather several types, each with distinct causes and characteristics. Understanding these differences is the first step toward effective management and prevention. At its core, diabetes is a condition where your blood sugar levels are too high. This happens for one of two main reasons. Either your body isn't making enough insulin, or your body cells aren't using the insulin it does make effectively. Insulin is a vital hormone that acts like a key, allowing sugar, glucose from your food to enter your cells for energy. When this system goes awry, sugar builds up in your bloodstream. It's important to know that diabetes isn't a single condition. There are different types, each with its own causes and characteristics. Type 1. Diabetes. This is an autoimmune disease. In simpler terms, your body's immune system mistakenly attacks and destroys the cells in the pancreas that produce insulin. This means your body makes very little or no insulin at all. Because insulin is essential for survival, people with type 1 diabetes must take insulin daily to manage their blood sugar and live healthy lives. Prediabetes. Think of prediabetes as a warning sign. Your blood sugar levels are higher than normal, but they aren't high enough yet for a full diabetes diagnosis. The key issue here is often insulin resistance, where your body cells don't respond well to the insulin your pancreas is making. The good news about prediabetes is that it's often reversible. By making significant lifestyle changes, such as adopting healthy eating habits, getting regular exercise, and achieving modest weight loss, you can frequently prevent or at least delay the onset of type 2 diabetes. Type 2 diabetes. This is the most common form of diabetes, and while it's often diagnosed in adults later in life, it's increasingly affecting children and adolescents too. Type 2 diabetes is strongly connected to lifestyle factors, particularly your dietary choices and activity levels. In this type, your body either doesn't produce enough insulin, or the cells become resistant to insulin's effects, or both. Many people with type 2 diabetes also have metabolic syndrome. This isn't a single disease, but a cluster of health conditions that significantly increase your risk of serious issues like coronary heart disease, stroke, and other chronic diseases. To be diagnosed with metabolic syndrome, you typically need to have 3 or more specific conditions, which include a large waistline, high blood pressure, high cholesterol, high triglycerides, elevated blood sugar, and low good HDL cholesterol. Our body needs insulin to use sugar, says Dr. Tina Cheng. Insulin moves glucose, sugar, into your cells for energy. When you eat carbs, from dairy, grains, fruits, veggies, or sugary foods, your body turns them into glucose. Your pancreas then makes insulin to move the sugar from your blood into your cells. Simple sugars like fruit juice or honey are used faster. They can cause a quick release of insulin. Insulin also helps store sugar as glycogen in your liver and muscles. But there's a limit. If you eat too many carbs, insulin can help store them as fat, triglycerides. Eating sugar doesn't directly cause diabetes. However, a diet high in added sugars, unhealthy fats, and too many calories does raise your risk. High sugar diets also increase the risk of being overweight, obesity, fatty liver, and metabolic syndrome. Dietitian Caroline Thomason adds, sugar intake can definitely impact type 2 diabetes. More sugar means more blood sugar, so it makes sense there's a link. But she agrees. Eating sugar alone isn't enough to cause diabetes. Dr. Chung notes that how your body makes and uses insulin also affects your risk. While diet and lifestyle play a big role, other factors can increase your risk of diabetes. The American Diabetes Association recommends that everyone start getting screened for diabetes at age 35. However, some individuals might need earlier or more frequent testing. This is especially true if you're overweight or obese, meaning a body mass index or BMI of 25 or above, or 23 or above for Asian Americans, and have one or more of the following risk factors. A close family member with diabetes. If a parent, sibling, or child has diabetes, your risk goes up. High-risk race, ethnicity. Certain ethnic backgrounds have a higher predisposition to diabetes, including African Americans, Latinos, Native Americans, Asian Americans, and Pacific Islanders. History of cardiovascular disease. If you've previously experienced heart disease, your diabetes risk increases. High blood pressure. Blood pressure readings of 130 over 80 millimeters of mercury, or higher, or if you're already on medication for high blood pressure, signal a higher risk. Unhealthy cholesterol levels. This includes having low good cholesterol, HDL below 35 milligrams per deciliter, or high triglycerides above 250 milligrams per deciliter. Polycystic ovary syndrome, PCOS. This common hormonal disorder in women is strongly linked to insulin resistance and an increased risk of type 2 diabetes. Physical inactivity, a sedentary lifestyle, significantly raises your risk. Having prediabetes. If you've already been diagnosed with prediabetes, it means your blood sugar levels are higher than normal, putting you at a much greater risk for developing type 2 diabetes. Other conditions linked to insulin resistance. This can include conditions like severe obesity or acanthosis nigricans, dark velvety patches of skin, usually in body folds. Previous gestational diabetes diagnosis. If you had diabetes during pregnancy, both you and your child are at higher risk for developing type 2 diabetes later in life. HIV. Certain treatments and aspects of HIV itself can increase diabetes risk. Knowing these risk factors can help you and your doctor decide on the best screening schedule to keep an eye on your blood sugar health. Eating to lower your diabetes risk is simple. It's about healthy eating for everyone. Dietitian Colton says, eat a nutrient-rich diet most of the time and get regular physical activity. She suggests eating lots of vegetables and other natural fiber sources. This includes fruits, beans, lentils, unsweetened oatmeal, and whole grains. Limit refined carbs and sugar. Use the My Plate method, half your plate veggies, a quarter lean protein, and a quarter starch, like beans, whole grains, or starchy veggies. Thomason agrees with the plate method. Protein and veggies won't spike blood sugar, she says. They slow digestion and stabilize levels. High-fiber carbs also slow down sugar release, reducing blood sugar spikes. Many eating styles can help prevent diabetes. These include the Mediterranean diet, a plant-focused diet, a vegetarian diet, and a lower-carb diet. The best plan for you is one that you enjoy, fits your life and culture, gives you all the nutrients you need, and you can stick with. If you need help, talk to a registered dietitian. Diabetes is a complicated disease that is not caused by one factor alone, but rather a constellation of factors that contribute to a diagnosis. Eating sugar does not cause type 1 diabetes, which is an autoimmune condition. While treatment for all types of diabetes includes lifestyle modification, type 2 diabetes may be prevented or delayed with behavior modifications such as a healthy diet and regular physical activity. Eating a well-balanced diet that's low in added sugar and rich in plant foods such as fruits, vegetables, nuts, seeds, and legumes can help reduce your risk of type 2 diabetes. Practicing the plate method is a simple yet effective way to eat well. Consider allocating half of your plate to non-starchy vegetables, 1/4 to lean protein, and the other quarter to high-fiber carbohydrates. If you need assistance or guidance, reach out to a registered dietitian or certified diabetes care.